Hip internal rotation mobility and strength is underrated, and for no good reason. We are going to work on hip internal rotation strength because it is critical for making sure that your hip can move the way that it's supposed to. It's also associated with low back pain. So if you have decreased hip internal rotation, range of motion, and strength, that can contribute to low back pain. It's also essential for walking and running mechanics. So I got obsessed with internal rotation generally, because of my love of running, right? So I had focused so much on external rotation, flexibility and strength and hip extension and activating my glutes. And what I found is that by incorporating this hip internal rotation, range of motion and strength, that I've been able to unlock some of my potential in terms of improving some of my glute strength and hip and core stability. Don't be surprised if this feels really weak. So when I was choosing what I wanted to show you guys, I had found for myself that it was really challenging to do these two exercises. So think of this hip internal rotation strength as kind of level 1. Then what we're going to do is then we can add another layer on top of that. But what we first need to do is we need to improve our flexibility first, then we start to improve our strength. So we're isolating that hip internal rotation strength, and then we can start to make that a little bit more complicated, and then we can also integrate it into other strengthening. But let's start with the basics, because the basics build a really good foundation for improving that overall strength. Also, this hip strength is going to reinforce some of that hip range of motion in internal rotation. So make sure that you check out the video for the hip internal rotation mobility, because that's going to help you to be able to access this strength. I'm going to show you 2 different exercises. Your adductor muscles, your groin muscles, are responsible in part for bringing your legs together and then also turning those thighs in. Now, we're going to isolate them in what will seem like a simple way. I want you guys to be really specific about how you're moving, because that's what's going to create that pathway to your brain so that it knows how to activate that muscle when you're doing something that's more complicated. So you need to be really focused on how you're doing this. For side lying hip adduction plus internal rotation, you're first going to start by lying on your side in one line. You're going to pull those lower abdominal muscles in. Make sure that you're lying on that tricep, because that's what's going to allow you to be in a stable position in your spine as well. Pull those lower abs in. What I see the common mistake is that people are kind of in this pike position. You want your legs in line with your trunk, okay? Now, you're going to bring your right foot in front of your left. That's going to free up this bottom leg. This is the leg that we're strengthening. So we're going to do this adduction motion. Okay, so here I'm adducting, I'm lifting this leg up. Now I'm going to turn my leg in. This is internal rotation. And then I'm going to turn back to neutral and then come down. So remember, what I'm trying to do is I'm trying to move from that thigh as I do this. So I'm not just moving my ankle, I'm trying to move this whole thigh bone as best I can in order to be able to get that internal rotation. So I'm really activating those adductor muscles, those groin muscles. So I'm doing these 2 movements of adduction plus internal rotation, and then coming back to neutral and then down. So take your time, isolate these movements. Try not to move anything else aside from the bottom leg, and you're going to do 10 on each side. Supine internal rotation combines isometric adduction plus active internal rotation. So what I mean by that is you're going to be doing an isometric contraction of your adductors by squeezing a block or a foam roller, and then you're going to be actively moving into internal rotation. This is going to help us to activate those groin muscles. Those are some of the main movers of internal rotation. Start by lying on your back, and I want you to be thinking about the position that your spine is in. So I don't want my back totally flat against the ground, but I also don't want it overly arched. I want to try to keep a neutral position in my spine. So I should be able to just slightly put my hand underneath my lumbar spine. I'm going to pull my lower abdominal muscles in, and then I'm going to put the block in between my knees. I'm going to squeeze my legs together. Okay, this is that isometric adduction motion, pulling those lower abs in. Then I'm going to lift my legs up. I'm going to re-find that position of squeezing my legs. Then I'm going to try to bring both feet out to the side and then come back to center. and then both feet out to the side and come back to center. So this, I'm actively moving into internal rotation when I do this. This is hard for me. I can't do this very easily. So I'm really trying to just isolate that movement. So I need to be thinking about my thigh bones are turning in toward each other, okay? You might even want to use your hands on the back of your thighs to kind of like pull them out to the side. And then you see how my feet are moving out to the side. Then that is that internal rotation range of motion. I'm going to do 10 just like this. Start with doing 2 to 3 sets of the side lying adduction plus internal rotation, and then the supine adduction plus internal rotation. You'll need a block for the second exercise. Remember, you want to be really specific about how you're moving because it's not easy to activate these muscles. So I want you guys to be really precise with how you're moving because that's what's going to create a really good foundation for then adding in the next layer. Remember, if these don't really feel that accessible to you, it probably means that you need to spend a little bit more time first working on the internal rotation mobility. So make sure to watch that video, do those exercises consistently for about 2 to 3 weeks. About then is when you'll be able to start to move into this first layer of some of the strengthening for internal rotation. Now, if this feels too easy, have no fear. We are going to be adding another layer to this internal rotation strength. But what I'm super specific about is making sure that we do everything in a systematic way. So we need to be able to check off these boxes of the internal rotation mobility, then this first level of internal rotation strength, before we can move into some more complicated things. But have no fear, I will provide that for you guys, so stay tuned. I love your guys' feedback. So if you are as surprised by some of these exercises as I have been, please feel free to comment. I also really like to hear you guys' feedback in terms of what feels easy, what feels difficult. If you guys have any questions, feel free, just comment below because I'm happy to answer any questions about this. This is not easy. You need to be really precise about how you're moving because it's very common that we lose this range of motion and we lose the strength and we use all these other muscles. What we're trying to do is we're trying to improve how our hip is able to move. That's what's going to allow us to have better lumbopelvic mechanics. It's going to allow us to have better mechanics while we're walking and while we're running. So I'm excited to add this next layer of internal rotation strength.